It's time for Studio 7, sponsored by your Permian Basin Chevy dealers.
It's the art of dentistry. Dr. Rutherford.
Welcome back. Gum disease affects more people than you might realize. Dr. Robin Rutherford joins us now to explain what exactly gum disease is. Dr. Rutherford, thanks so much for being with us.
I enjoy it.
Okay, so all about gum disease today.
All about gum disease. Just what you wanted to know about,
Right.
what you wanted. Exciting, huh? Okay, gum disease is an infection. Now, if you have an infection like you have a cough or something, you go to your physician and he gives you antibiotics and maybe that takes care of it. And it goes away and you're fixed. True? That never happens in dentistry. Almost never happens in dentistry. Almost never does a dentist give you antibiotics for something and it goes away and it's fixed. Because usually there's a reason that needs to be fixed.
Okay.
There's a source for the infection. And gum disease is an infection. And the real biggest reason for gum disease is plaque and tartar that's on your teeth. Okay, so my title for today's thing is 2 misconceptions and 1 big lie.
Okay.
One first misconception is that if my gums bleed, that's normal when I brush, you know, that's okay, right? That's normal, right? Well, it may be normal for you, but no, it's not okay. No, it's not healthy if your gums bleed. If you take a shower and your arm bleeds or something, is that normal? Oh, it always happens. No, it's not normal. There's something going on, right? Well, if you brush your teeth, floss, anything you do, and your gums ever bleed, even a little bit, if your toothbrush is a little pink, then you have some bleeding, that is a sign that there is an infection.
Okay.
And so gum disease is usually because things are not clean enough. First photo, good example. Well, this is a good example of bad. Good example of bad.
Yeah.
But anyway, this is somebody, a patient of mine, came in looking this way and with a lot of tartar and calculus, we call it, tartar and plaque. Plaque is just the layer of germs. When you kind of like you can do with your fingernail and it feels like it's cleaner, or it feels like your teeth are wearing little sweaters, you know, because you haven't brushed, that's plaque.
Okay.
That's just the layer of bacteria. Now that brushes off. But once it's been there long enough, plaque will harden on, and that's when we call it tartar, also known as calculus.
Okay.
But tartar will not come off when you brush. So my first misconception is, isn't it okay if my gums bleed? Okay? No, it's never. And the second misconception is, well, if I have tartar that now has hardened on, then I just need to brush more, right? No.
Okay.
The thing is now tartar will not come off to a brush or floss.
Okay.
Now you're just brushing the tartar and it never is clean. And if you look at this, like right along the gums are darker red. See how they're dark red, really like right there quite a bit? And right along the edge, you know, maybe they're a little more pink further away, but right along the gum line where all that tartar is right up against the gums, that's what keeps it infected.
Okay.
And so the misconception, can't I just brush better or can't I just brush it off? No, because it will not come off unless you have your teeth clean,
I was gonna say, how do
by
we
the
get rid of
dentist,
it
by
then?
the hygienist.
Okay.
So that's the second thing. But when we get all that off, you know, then you can start to heal because it's only a matter of, is it clean enough? As long as, like if you get a splinter in your finger, well, gee, why does it stay red? Why does it stay sore? Well, as long as the splinter is there, it's going to do it, right? You get the splinter out and it should heal, you would expect. And so that's the source of the problem. So the tartar, the bacteria, and all that is the source of the problem.
Okay.
So here's another photo, different patient, but the same sort of thing. There's quite a bit of tartar. In fact, it's pushing the gums down. When we take the tartar off, the gums may very well not ever recover.
Okay.
It may have been, you know, if you have gum disease, the infection eats the bone away from around the roots of the teeth. And so as the bone level goes down, 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 the gum level just follows the bone down. And so if you have places where your gums have receded and you're looking at the root of your teeth looking at you, well, that means there's no gums, but there's no bone over the root of that tooth. You know, and that means the gums have headed south and so have the bone. Well, and so, you know, this is stain and everything that's on the tartar, but when we get all that cleaned off, well, then it can go back to being healthy. Although you may have some permanent bone loss, and that's where people end up losing their teeth from gum disease.
Okay.
If you lose enough bone from around the roots of your teeth and the bone level's down to here now instead of up to here like it should be, then your teeth start to get loose maybe, you know, and it's maybe just too far gone.
Okay.
So anyway, that's what you don't want to get to. So if your gums bleed, if your breath is not as good as it should be, show up at the dentist quickly. Now that's the third thing. The two misconceptions and the one big lie. The one big lie is having to do with bad breath. Oh, swish with Listerine. Swish with whatever mouthwash you want. That is a total lie, and the companies that make those products make millions and maybe billions of dollars a year from people, you know, thinking that they need mouthwash and because that covers bad breath. No, bad breath is because your gums are infected.
Okay.
And so your breath is always going to knock people down. Your breath, ask your spouse, you know, they'll probably tell you, but just swishing with something might help for about 30 seconds, right? But it just makes sense. So there's a source for the problem. There's a reason for the problem. So the big lie is that actually, I don't think mouthwash really does anything at all.
Okay.
Unless it has fluoride in it. If it has fluoride in it, which a lot of them do, actually that's a good thing. You give yourself a little fluoride treatment, which is good for helping to prevent cavities, although it doesn't do anything for gum disease. But it's good. Fluoride helps protect against cavities. So definitely go to the dentist, have your teeth cleaned, and every 6 months, if you don't have any problems, is the interval. It's not once a year, that's your eyes checked.
Okay.
It's every 6 months.
For the teeth.
If you have no problems, if you do have gum disease, once we spend maybe 2 or 3 visits actually cleaning your mouth and getting some healing, maybe we need to see you every 3 months or every 3 or 4 months.
Okay.
At least for a while we continue to heal. And hopefully you can graduate back to somebody who doesn't have problems in every 6 months.
Perfect. Well, Dr. Rutherford, thank you so much for being with us today. We appreciate it.
Thanks.
It's the